Hi, my name is Erin Knox. I'm a physical therapist here at Pinamonti Physical Therapy. Thanks for tuning into our Facebook Live video. Today we're going to be talking about the vestibular system. So the vestibular system is part of your overall balance system. It also involves 3 semicircular canals. Those canals are filled with fluid, so when you move, the fluid will also move and it will tell your system that you're moving in space. One of the things that we do when we look at our vestibular patients, usually they're complaining of dizziness or unsteadiness. Maybe they're listing into the side of the wall while they're walking. Maybe they sit up in bed and they get a little lightheaded, or sometimes they complain of vertigo. So vertigo is spinning. It's spinning when you shouldn't be spinning, right? Maybe you lay down and you start moving even though you know you're not moving. So what we're going to do today is just go through a really quick evaluation. During my evaluations, I'll check eye movements, I'll check some positions, seeing like maybe if you lay down and you get some spinning, and then we check some balance. So I'm going to have a patient here with me today and we'll go through a really brief evaluation. So Nikki's here with me today. We're going to go through just really briefly. We're going to screen her eyes and see how well she's doing tracking an object. Then we're going to go through and look at how well she's able to cross her eyes, right? We'll go through and check some quick eye movements. We'll screen out some cervical mobility, watch how she's doing keeping her eyes on a target, and then we'll take her back into what's called a Dix-Hall pike, which is just that positional test that we talked about a little bit earlier. So first thing you're going to do is just follow the tip of my pen with your eyes. Usually when people are having a hard time tracking or working on gaze stability, then we'll see some deficits with some of this screening. So then you're going to follow the tip of my pen all the way in across her eyes. She does a really great job with that, and then back. Very good. Next thing we're going to do, you're going to look at my nose and then the pen. So kind of quick, nose, pen, great. Good job there. Very good. And so now what we're going to do is we're going to watch your gaze stability. So you're going to look at the tip of my nose. You're going to tilt your head down, and you're just going to keep your eyes on my nose. Good. Good. And she does a really great job of that too. So when we turn our head, we should be able to keep our eyes focused. Now you're going to lay on the bed. You're going to just sit. There you go. I'm going to turn your head. You're going to hold my arms, and we're going to go back on the count of 3. Try and keep your eyes open for me, okay? So 1, 2, 3. And we're tipping back. So what I'm looking for here in this position is what we call nystagmus. It's a rapid involuntary eye movement. Sometimes people will have a positive in this position. They'll get some spinning, they'll get some dizziness, they might feel nauseous, and then we would go ahead and treat them here from this position. Nikki's good, so we're going to go ahead and sit back up. Make sure she's not dizzy when she's sitting. Everything checks out. So based on what we find in our evaluation, we'll go ahead and treat today. I usually give patients some things to go home and work on too, some homework that works on positional balance, their eyes, maybe standing on one foot, always in a safe place, right? So if you have any questions or concerns or comments, right, feel free to leave a comment on this video. You can get a hold of me at erin.knox@pinamontipt.com, or you can call our front office and schedule an evaluation with me. So thank you for tuning in. Be sure to like, share, and subscribe to all of our social media outlets, Facebook, YouTube, Instagram. Thanks for tuning in.